Right, well, thank you. Welcome everybody to our latest community conversation. My name is Carter Ross, and I've been working with DC Villages for a while now, alongside Dr. Polk, who is the executive director of DC Villages. DC Villages is the organization that sort of helps coordinate some citywide activities between the 13 villages across the city. Um, and this is our second community conversation with DC Health. First one is up on our YouTube channel. I'm going to put that link in the chat. So if you want to see prior discussions and other community conversations, please check that out. And I want to give a heads up. Our next one is going to be on October 15th, and we're going to be talking about brain health there. And so I just want to welcome Dr. Coleman from DC Health here to be able to talk to us today about respiratory virus season, which is unfortunately coming in strong this year. I've already gone through one bout of COVID, and hopefully we'll not have another one for a long time. So, Dr. Coleman, want to take it away? Unless Dr. Polk, there's anything you want to add in that I forgot to say.
No, nothing. Just welcome all. And yes, so Dr. Coleman, have at it.
Good morning, everyone. Thank you so much for welcoming me back. I had a wonderful time at our first community conversation, and so now we're here for a second one to talk about something that is very important to all of us, which is this year's respiratory virus season. So I'm actually going to shut off my mic, not my mic, my camera, so that people can really focus in on the slides. And so give me 1 second here to share my screen with everyone. All right. And okay. Can everybody see my screen? Oh, wonderful. Okay, so I'm going to cut this video for the time being. All right. So as I said before, today we are talking about this 2024, and really it's 2024-2025 respiratory virus season updates. So a health disclaimer that I always like to give. I just want to make sure that everyone understands that this presentation is provided for educational and informational purposes only and does not constitute providing medical advice or professional services. The information provided should not be used for diagnosing or treating a health problem or disease. And those seeking personal medical advice should always consult with a licensed physician. Always seek the advice of your doctor or other qualified health provider regarding a medical condition. I am a doctor, but I am not an MD or a DO. I am a PhD, which means I know a whole lot about a little bit. That's what I tell people. All right, so this is our agenda for today. We're going to hit on some very key information. It's a lot of information, but we are going to make sure that we leave time for questions. So let's get started. What is respiratory virus season? We hear about it more recently now. I never really thought about respiratory virus season. I don't remember hearing a whole lot about it when I was growing up as a child in DC, or even as a young adult, but definitely hear about it now. So let me just give you the facts, just the facts. The respiratory virus season really deals with primarily 3 respiratory viruses, that is influenza, the flu, COVID, and respiratory syncytial virus, also called RSV. Now, these viruses are always around us. They circulate throughout the year, but we tend to see a definite increase in the spread of these viruses during the fall and the winter, especially between the months of October and March. So that's why you see a lot more promotional materials, hear a lot more about it in the news and on the radio and just in everyday conversation. So who is at risk? I want everybody to take a minute and just breathe. Take a deep breath in and let it out. Okay, so if you took a breath, you're at risk because that means you're breathing. So everybody is at risk because respiratory, we actually do breathe. But there are some persons who are at higher risk for what we call severe illness. And so when we talk about flu or COVID-19, persons who are at what we consider to be a higher risk for severe case are persons who are 65 years of age or older. If you are pregnant, if you have certain medical conditions like obesity, asthma, diabetes, heart disease, and that includes hypertension or high cholesterol, or you have a weakened immune system, you are at a higher risk for severe disease. And when we say severe disease, we're talking about disease that may end up putting you in the hospital or on a respirator, or, God forbid, actually resulting in death. So these are the people who are at higher risk for severe illness, for flu or COVID-19. Now, you're considered to be at high risk for severe RSV if you are 75 years of age or older, or if you are between the ages of 60 and 74, living in a nursing home, or you have specific medical conditions. And you're going to you see some of these, repetition here. So diabetes, heart disease, again, that includes chronic high cholesterol, as well as hypertension, obesity, and kidney disease. So we want to make sure that you understand that if you fall into any of these specific categories, you are at high risk for severe RSV. So what is what I call, and this is my term, this is not anything that DC Health or CDC or the FDA or anybody else has come up with, but I call what we are dealing with this time of year the respiratory triple threat. So the respiratory triple threat, boy, say that 5 times real fast, is something we all know. First, COVID-19. We've been dealing with and living with COVID-19 for several years now. The wonderful thing is, of course, that now we actually have a vaccine, but this causes respiratory symptoms that oftentimes feel like a cold, the flu, or pneumonia. And that's one of the things about these respiratory viruses is that they all kind of feel somewhat the same. At least at first. And so it is upon us to make sure that we do our best to protect each other and ourselves. COVID can attack more, however, than just your lungs and your respiratory system. We have heard of and seen studies where COVID has spread, or the effects of COVID have impacted the cardiovascular system. In some cases, have caused what people commonly refer to as kind of a brain fog as well, which is really very interesting. And I see Carter shaking his head. Yeah, I've had COVID once, knocking on my little fake wood here. And pray that I don't have it again. But that brain fog was no joke. Most people who actually get COVID these days will have, if they're vaccinated, will have mild symptoms, but there are still some people who can become severely ill. And you can see some of the complications that can develop due to COVID. And that picture in the background, that's actually a picture of the virus itself. And then we have influenza, flu. I said this last month. If you have ever actually had the flu, you definitely do not want to ever have it again. It is a contagious respiratory illness that infects your nose, your throat, and sometimes your lungs. And it can actually lead to very more serious issues, such as bacterial pneumonia, ear infections, sinus infections. It can actually aggravate certain chronic medical conditions. And what I also reinforced last month was the fact that people do still die from the flu. So it really is very important that you pay attention to when the new vaccines come out. And then the last piece of this triple threat, this respiratory triple threat, is RSV, respiratory syncytial virus. I love that. I like to make sure that people can actually pronounce what these some of these diseases are, or these viruses are, because very often they put them up and then they don't tell us how to pronounce it. And so we're calling it RSV, but we really don't know what it is. Again, this is actually a common respiratory virus. I didn't hear about it. For some reason, I had never really heard of RSV until recently. And so it has been something now that is on the front of my mind, not only for persons who are of older age, but of course also because of how we know that it does infect children. But this is another virus. It infects the lungs, can affect the nose and the throat, and it usually peaks in December or January. And you can see some of the complications there. It can lead to pneumonia. It can cause inflammation in the small airways of the lung, which is why it is especially dangerous for infants, because if I do a really quick biology lesson, those small airways going into the alveoli, which are the smallest kind of pockets in the lungs, that's where the oxygen transfer goes from the air that you breathe and transfers that oxygen into your blood system. And so for the little ones, if they can't breathe, they can't get oxygen in those little bodies. And so it actually can be especially dangerous for infants and young children, and of course, older adults. Now, because I'm talking to older adults today, I also want to be mindful about pneumococcal disease. And I will tell you that you do need to be concerned about pneumococcal disease if you are 65 and older. Pneumococcal disease is caused by a very specific bacteria. And we know that this bacteria can actually cause a lot of different types of infections. So it can cause pneumonia, which is an infection of the lung. It can cause meningitis, bacteremia, otitis media, which is nothing more than a middle ear infection. But if you've ever had a real middle ear infection, they're not fun at all. They hurt, and they're just not a good thing. And then sinusitis, which is a sinus infection. And the complications that are associated really depend on what part of the body is infected, but it can be very serious. And so I'm going to talk to you in a minute when we start talking about prevention, what you need to do. Again, pneumococcal disease is important, especially if you are 65 and older. So prevention. This is where we get to the good stuff, the nitty gritty. So let's talk about what actions we need to take to prevent these, or do our best to prevent these respiratory viruses.
You and your family deserve to stay healthy this virus season. Some adults are at increased risk for serious illness, including hospitalization from diseases like influenza, RSV, and COVID-19. Here are some easy steps to help keep your family healthy. 1. Wash your hands often. 2. Clean frequently touched surfaces. 3. Get vaccinated, the best form of protection. Call or visit your local community health center, health department, or pharmacy with questions about vaccination or to schedule a vaccination appointment. Learn more at lung.org/vaccines or call 1-800-LUNG-USA for help.
Really short video, but really gave us a lot of good information there. I mean, sometimes people think tell me, they're like, oh, I didn't even think to go and look at the American Lung Association. But again, we're talking about respiratory viruses. So why wouldn't you look at the American Lung Association? So they gave us some good information. So let's go and kind of break those down. And I'm going to go out of the order that they went, because I'm going to tell you the first thing that I want to talk about is getting vaccinated. That is the best preventative measure that all of us can take. Just a quick review of how vaccines work. Vaccines work by actually imitating the infection so that your body will develop antibodies, which are the fighters. Okay, they'll remember that virus, and they'll say, oh, I know how to fight this. And so that's what they do. It teaches the body how to defend itself without actually giving someone the full-blown disease or illness. So from the CDC, this is our fall and winter immunization guide. We have gotten to the point now where we are having annual updated vaccines. So we have currently available on the market the COVID-19 and flu updated 2024-2025 vaccines. This is the vaccine that you want to go get, or the vaccines that you want to go get. These are two separate vaccines. We haven't gotten to the point yet where we have a combination of these in one shot. But you want to make sure that you're getting the updated 2024-2025 vaccine. And that's everyone who's at least 6 months of age or older. And right now, one shot. All right. If you are older, you can talk with the pharmacist and your physician or your medical professional about whether or not you may need to get a second of these shots later on. But right now, the recommendation is one shot, and this is the time to get it. I am going to talk about RSV immunization to protect babies. And so I'm just really going to deal with this kind of first part of this second square, where it's talking about the vaccine. If you are a pregnant person between 32 and 36 weeks of pregnancy during RSV season, all right, and we are in RSV season, so you need to go ahead and you need to get the vaccine, all right, because that will actually help you as the pregnant person to protect that infant or that baby. And then there's the RSV vaccine for older adults, all right? Currently, older adults only need to get the RSV vaccine once. You don't need to get it every year. So if you got it last year, you're fine. You don't need to get it again this year. You do need to go back and get this COVID and flu updated 2024-2025 vaccine, but you don't need to get the RSV vaccine if you got it last year. If you are age 60 and over and at high risk of severe RSV, and that means that you have certain other health diagnoses, and we'll go into that, you should talk with your doctor, but you should probably, and you have not already gotten this vaccine, you need to go and get it. And then if you don't fall into that range, anyone and everyone age 75 and older definitely needs to go ahead and get the RSV vaccine. So why do you immunize? Well, because this right now really is our best defense against viruses. I was looking at a news story on CBS Sunday Morning. I don't know if anyone happened to see that this past Sunday, but they were talking about vaccines. And, older persons in this country and even around the world, but especially in this country, are still old enough to remember what life was like with measles, what life was like with mumps, what life was like with polio. My generation, I'm 50. well, 51. I don't know what life was like with those diseases. The only thing that I know about polio is pictures that I have seen of people in iron lungs. I don't have that first hand experience or knowledge. I just don't, because of my age, because quite frankly, by the time I got to the point where I knew what was going on with immunizations and vaccinations, we had pretty much almost completely eradicated polio, and very rarely did we see mumps or measles or anything like that in this country. However, okay, we are seeing those come back, and that's a lot due to the fact that we have people who are not getting those immunizations. But these immunizations are our best defense against viruses that can cause these types of serious illnesses. Viruses still do cause people to go into the hospital every respiratory season. There are still people who are getting hospitalized for COVID, hospitalized for flu, and hospitalized for RSV every year. And just so you know, among children or infants, RSV is the top reason for hospitalization in the United States, something that is wholly preventable, but yet it's right now is the number one reason. Also, we have some people who that we know are at higher risk, but we can't predict who's going to necessarily get severely ill. Adults 65 and older are 4 to 5 times more likely to be hospitalized for our triple threat than those who are under the age of 65. I don't know about you, but even as a child, I don't want to go to the hospital. And as I get older, the thought of going to the hospital actually makes me very scared. And now I understand what Grandma used to talk about when she used to say, "Don't take me to the hospital," because, old folks used to say that the hospital, you go there to die. And so I don't want to go to the hospital to die, but I also don't want to sit at home and die either. So I want to make sure that I do what I have to do to try and keep from going to the hospital. Also, it's important, and I note this, that half of the children who end up getting hospitalized with COVID had no additional health issues. So they were perfectly healthy in every other respect, but they actually ended up still going to the hospital. And as I've said before, immunizations really are our best defense. Vaccines do cut our risk substantially from being hospitalized. And understand that last year, okay, so the 23-24 season, 95% of the people who were hospitalized due to COVID-19 were not up to date on their vaccination. 95%. That's staggering. But again, so preventable. So we want to make sure that we're doing everything that we need to do to protect ourselves. Vaccines help you risk less and do more. I don't know about you, but I love seeing seniors today, because it just seems like, not that seniors in the past weren't active, but there are just so many other things that older people and wiser people can do. So many opportunities. My mother is 80 and she's in about, 3 different programs out in Prince George's County. She does water aerobics twice a week. She does aerobics twice a week. She's in this walking group now, and she's learning how to swim. She's taking swimming lessons for the first time in her life since college. And so she wants to be at less risk so she can do more. She's like, I might be 80, but that doesn't mean that I'm going to sit and just, whittle around and sit in my rocking chair or my recliner and just watch TV all day. No, she keeps it moving. So vaccinating against COVID and flu definitely can help keep you from getting sick. It can help keeping it. Now, it can. It's not the be-all, end-all. All right. These are not cures. But if you do get sick after being vaccinated, the key here is that for the most part, your symptoms will likely be extremely mild, and therefore you can recover. You don't, that likelihood of going into the hospital is significantly reduced. Also, vaccines really are a safer, more dependable way to build up your immunity than saying, oh, I'm just going to go catch the virus and build up my immunity. I'm at the age where I can remember chickenpox and how when I was a child, this was before the chickenpox vaccine, somebody at school or somebody in the house or your cousin got chickenpox, parents would go, yeah, go on over there. Go over there and get it so we can get this over with. Because if you got exposed to it, you would get it, you would build up your immunity, and it would be over. We don't want to do that. We don't do that. Okay, that's not the way we want to go. All right, getting a vaccine is a safer and more dependable way to build immunity. All right. And if you haven't, again, I'm going to say this, I'm going to sound like a broken record, so I'm going to keep saying it. If you haven't gotten them yet, now is the time to get your 2024 flu vaccine and your 2024 COVID vaccine. The formulas that we have for both flu and the COVID vaccines change every year so that they can try to stay up with the variants, okay, and be as effective with the current variants that are circulating, or the strains that are circulating in the community right now. So that's why it's important that you get the current, vaccine. Even if you got the original, now you need to get the current, all right? There's three other reasons that the federal government is also really hammering on with this risk less, do more campaign. Again, you may be high risk and you don't even know it, but we've talked about this already. If you are over 65 and you have certain medical conditions, or you have a weakened immune system, even if you're pregnant, you could be your baby could be at risk for RSV. I'm not 65, but I'm a diabetic, so I make sure that I go get my vaccines. I get everything that I'm eligible to get. Also, we know that vaccines, again, work best to keep you from getting severely ill. If you do, by some stretch of fate, get infected, the fact is that most people are going to end up having a mild case and not need medical or hospital care. And then lastly, you can protect the people you love, by encouraging them to come with you, and that they can get vaccinated with you so that all of you can reduce the risk of serious flu, COVID, and RSV. So here's the nitty-gritty when we come to these shots. Again, COVID-19, everyone age 5 and older should get one dose of the updated, and in this case, we're talking about the 24-25 updated COVID vaccine, all right, to protect against serious illness. And we have a link here to CDC, so you can actually go look at the schedule. Flu, you should get an updated dose, in this case, the 2024-2025 vaccine, updated vaccine for flu every year. You should get that flu vaccine every year. Let me say that, I'm going to go to the third one, and then I'll say something. RSV, you get one dose during your lifetime. Remember, if you're age 75 and older, you definitely need to go get this vaccine if you have not gotten it previously. If you have not gotten it previously and you are between 60 and 74 and you have some of those chronic diseases that we talked about before, meaning that you're at increased risk for severe RSV, then you need to get it. And you can get it at any time, but now is the best time in the early fall before things start ramping up. I want to say that for these three vaccines, there is nothing that prevents you from getting all three at the same time, other than the fact that you might have a really sore arm. But there is no problem. The medical professionals have said that It is okay to get all of them at the same time if that's what you want to do. If you don't want to do that, you can get one at a time and space them out, over a couple of weeks, or you can get COVID and flu at the same time and then go back and get your RSV. But the key here is make sure that you get them. And then when we come to pneumococcal disease, this is a immunization that is recommended and required, not required, but recommended for persons age 65 and older. And depending on the type of vaccine that you are given by your medical professional, you'll either get one or two doses. All right. And so if you have not had your pneumococcal vaccine or your immunization, please make sure that you talk with a medical professional to see whether or not you need to get that, and they will discuss with you which vaccine type is best for you. So where can you go? Glad you asked. Well, you can go to your primary care provider. That's a physician, a nurse practitioner, or a physician assistant. You can go to most of the DC area pharmacies, CVS, Walgreens, Walmart, Giant, Safeway, and other community pharmacies. Rite Aid, I believe, also has it in stock. But you can go to area pharmacies to get your immunization. You can also go to DC federally qualified health centers. We call those FQHCs. Those are groups like Unity Healthcare, okay, Whitman Walker, as just to name a few. Then, hey, you're right here with the villages. The villages will be having clinic events, so please see the village directors and look out for flyers around the villages for more information. And then DC Health does have a 2024 district adult vaccination locations document. It's several pages long, but if you have access to a smartphone or a laptop or a desktop someplace or a tablet with internet, you can actually go to our website, and I will be sending out these slides so that they can be put up with the video, and people can click within this video to actually get access to that document. All right, the second thing that they talked about was washing your hands. So we've got another short video because one of the things that I have noticed, and I pay attention to things like this especially when I'm in public places. I go into public restrooms and I watch how people wash their hands, and it kind of makes me a little nervous. So let's look at how to actually wash our hands.
Hand washing is one of the most important ways you can keep from getting sick and spreading germs to others. Dirty hands spread disease. This hand washing demonstration will show you how hand washing can get rid of germs and chemicals that get on our hands every day. This gel is like the germs and chemicals that we get from things we touch throughout the day, like our toys and pets. If we then rub our eyes, nose, or mouth, or pick up something to eat, the germs or chemicals can get into our bodies and make us sick. Studies have shown that people touch their eyes, nose, and mouth about 25 times every hour without even realizing it. To get rid of these germs and chemicals, CDC recommends you follow these easy steps every time you wash your hands. Wet, lather, scrub, rinse, and dry. We're going to show you the right way to do each step. First, wet your hands with clean running water. Turn off the tap and apply soap. Then, lather your hands by rubbing them together with the soap. Be sure to lather the backs of your hands, between your fingers, and under your nails. Scrub your hands for at least 20 seconds. If you don't have a clock nearby, keep scrubbing until you've sung the happy birthday song twice. Rinse your hands well under clean running water. Dry your hands using a clean towel, electric hand dryer, or air dry them. Washing your hands using the steps we just demonstrated is very important to get hands completely clean. Let's see how well we got rid of the germs and chemicals. Great. No more germs and chemicals. Why is this so important? Germs and chemicals from unwashed hands can get into our foods and drinks when they're being prepared or when we're eating or drinking them, which can make us sick. Also, germs and chemicals from unwashed hands can be transferred to other objects like cell phones, tabletops, or toys, and then transferred to other people's hands. That's why it's so important to wash your hands following these steps. Wet, lather, scrub, rinse, and dry, so you can stay healthy and help keep those around you healthy. For more information, visit cdc.gov/hand washing.
All right. So, how many of us looked at that and said, "Ooh, 20 seconds? Oh my!" Yeah, kind of a good refresher for all of us to have. So let's go over those steps again. Wet. Feel like I'm talking to some of the kids at my church, making sure, okay, turn on the water and actually get your hands wet first. Then you're going to get that soap. And I think it's really important that they say lather, because sometimes, we get soap and we may have too much water and not enough lather, and too much water and not enough soap, and we don't get a really good lather. But you want to get that lather up. So if you got to go back and get some more soap, then you get some more soap. They talk about scrubbing, making sure that you're scrubbing not only the palms of your hands, but between your fingers, the backs of your hands, and even maybe trying to, get up under your nails a little bit. And then you want to rinse with really good, clean, clear water. And one of the things that I'm not sure if everybody noticed, but if you noticed when she went to actually, she was cutting the water on. I'm really bad about this. Once I turn the water on, I don't cut it off. I let it run. So I'm not very good on being really a green person on that. But if you do turn it back on, if you notice, she used kind of her forearm to do that and not her hands that she had just finished washing, because granted, if you do that, whatever germs were on the either the faucet or the spigot or the nozzle to control the water flow, you're going to put that back on your hands. You're just going to deposit it back. And then you want to actually get paper towels or they said go to the hand dryer. I like paper towels. I used to work in restaurants, food service. And so one of the things they would always teach us is you rinse your hands, you grab the paper towel, you dry your hands with the paper towel, and you use that same paper towel to do what? Cut off the water. All right. And then if that paper towel is falling apart, then you can get a couple more paper towels. And what do? You use the paper towel to grab the handle to leave out of the restroom, even if it's at your own house. All right. Because keep in mind, if you've touched your doorknob before you've washed your hands, guess what? Those germs are still there. And very important to remember, when you do that scrubbing, 20 seconds. Now, they said the happy birthday song twice. When I was in school, they told us to do Old MacDonald and make sure that we got through 2 animals. So whatever works for you, that's what you use. But that 20 seconds is good. And I have an Apple Watch now. And so my Apple Watch has a setting where it can tell if I'm washing my hands, and it'll actually automatically start the timer at 20 seconds. So I love that too. Another step that they talk about or that we've heard about, and it's really important this time of year, is really taking steps for cleaner air. One of the reasons why we see this uptick in infections is because we're going inside and the airflow may not be as good. And so when you're sitting in an enclosed space and maybe the airflow is not good, germs actually will spread more easily. Virus particles don't have an opportunity to condense as much in the air when we're outdoors, which is why doesn't mean that it can't happen, but it does mean that they don't have an opportunity to really build up as much as they do indoors. This time of year, I can tell you I love the beginning of the fall and even sometimes the early winter because I like to keep my window open. Even if it's cracked at night. I try to bring in as much fresh air into my home as possible. I don't really open the doors, but I definitely do open my windows. And I do use the exhaust fan if I need to, or if you have ceiling fans, that's another good thing. Having your window open and then circulating that air with the ceiling fan. If you have central heating, or an AC system that has air ducts that go throughout your house, that means that you probably use a filter. This is critical, um, especially when it comes to respiratory virus season. You want to set your fan to the on position instead of auto, because when you're dealing with the on position, the air is continually circulating. If you have it on auto, it's actually going to cut off and on. So you're going to have that air kind of sitting for longer periods of time. Also, use pleated filters. I know that pleated filters are a little bit more expensive, but they're actually of better quality because of the way that they are manufactured. And I have this highlighted because this is something that my mother and I do like clockwork. We change our filter every 3 months or according to the manufacturer's instructions. We tend to change ours every 2 months because I actually have a cat. And yeah, you kind of have to. They get kind of nasty. But you want to change your filter on a regular basis. It is very important that you do that. And if you don't know how to change your filter, please call someone. It's usually very easy to change the filter, but it's actually very important. You can also get a portable high efficiency particulate air cleaner, which is we call it a HEPA cleaner. You can get some of these. You don't have to get a really big, huge, expensive one. You can get some reasonable HEPA cleaners off of Amazon. Sometimes you can catch them on sale at Home Depot or at Lowe's or other types of hardware stores. And then, if at all possible, when you can, move your activities outdoors. Okay, that's where the airflow is the best. And this time of year, we can kind of still do that. Now, when it starts getting icy and rainy and things like that, you can't, and we do understand. All right, let's talk about the difference between cleaning and disinfecting, because there is a difference.
At home. Let's talk about cleaning versus disinfecting. Cleaning is the removal of germs, dirt, and impurities from surfaces. It does not kill germs. Disinfecting kills germs on surfaces or objects. It works by using chemicals. Remember, the idea is to clean, then disinfect. The CDC recommends cleaning and disinfecting frequently touched surfaces every day. That includes tables, doorknobs, light switches, countertops, handles, phones, keyboards, toilets, faucets, and sinks. To properly clean dirty surfaces, use detergent or soap and water. To disinfect, the CDC says most common EPA-registered household disinfectants should be effective. You can also use a bleach solution by mixing 5 tablespoons bleach per gallon of water. Well, once again, when it comes to cleaning and disinfecting, you don't want to forget to wear disposable gloves. Once you're done cleaning and disinfecting, be sure to toss out those gloves and also wash your hands with soap and hot water for at least 20 seconds.
Okay. Cleaning and disinfecting. There is a difference between the two. We do a lot of cleaning, but we don't necessarily do a lot of disinfecting. And I love the fact that they emphasize the fact that you really do not have to go out to disinfect. You don't have to go out and buy, all of these extensive types of cleaners. You can do what grandma used to do and what she taught me to do was some bleach and some water. Get that in there, and you go ahead and wipe everything down after you've cleaned it. So gotten all the dirt off of it, and just let it sit. It will kill almost everything under the sun that I know of. All right. Now this one ought to make you laugh, and we're getting towards the end. Oh, we touch our face. Oh my, we touch our face. And so I'm going to play this short video that really talks about being cognizant and things that we can do to stop touching our face, because a lot of times we are spreading these germs and these viruses because we touch our face.
This is my face. Pristine, I know. And I just can't keep my grubby little hands from appreciating it all day. In fact, studies say I probably touch it an average of 23 times an hour. But not touching it is the easiest thing I can do to keep myself virus-free. Many viruses, like the coronavirus, are contracted through mucous membranes on your face, your eyes, nose, and mouth. Here are some tips to keep your hands clear of the T-zone. You generally don't know you're touching your face, so it's important to raise your own awareness of the act. Start by posting visual reminders to not touch your face or anything related to touching. We're talking nail biting, zit picking, eye rubbing, thumb sucking, spontaneous dental flossing, that kind of catcalling where you whistle with your fingers in your mouth. Don't do it. Place sticky notes that say no touching on your bathroom mirror, visor in your car, and the TV remote. Set your phone background to say don't touch your face. Maybe you'll only need it for a few days for the message to naturally set in. Keep your hands busy if you feel the need to touch something. A stress ball, keychain, beaded bracelet, rubber band, gemstone, or fidget spinner make great fidgets. Let's say you're on a conference call. What do you do with your hands? Knitting or doodling are great ways to keep hands away from your face. Do you like to lean your face into your palms? Lace your fingers together instead and place them on your lap. You'll fix your posture while you're at it. Wearing makeup can reduce face touching since it may make you more mindful not to smudge your beautiful work. Use eye drops to treat your itchy eyes so you won't be tempted to rub them. Keep your skin moisturized so you won't feel compelled to scratch, and get a manicure so you don't bite your nails. If you have bangs, you're going to want to swoosh them away from your face. It's just nature's way. Pull or clip your bangs back so you won't futz with them. You can also use barriers when you do need to touch. Keep facial tissues around so there's something in between your fingers and face. Wear glasses to create a barrier around your eyes. And if you made it through this video without touching your face, you can overcome the urge. Or just keep watching this over and over and over.
Okay, don't touch your face. It's amazing. It is amazing. I actually I was thinking about this yesterday and I was like, oh my gosh, I really do touch my face a lot. But I got to do some of these hints that she gives. Oh, let me go back. All right. Wear a face mask if you want to. It's okay. You can wear a face mask. And if you don't want to, don't feel like you have to. I've gotten to the point now where I am wearing a face mask when I go into some crowded places. I was over in a mall yesterday at Costco, and I was like, I got to put on a mask. Too many people in here. And then this is really critical. If you get sick, people, stay home. Stay home and stay away from others. It's going to be okay. All right, you'll be able to go and do whatever you're missing later on, but please stay home because you may have symptoms that may be associated with one of these viruses, or might be something else. But these symptoms, things like fever, chills, extreme fatigue, cough, runny nose, headache, among others. You don't want to spread that stuff to anybody, and quite frankly, I don't want you spreading it to me. So, enough said there. I am going to include these examples because a lot of times we have people to ask questions about, well, how long do I have to stay away from others? And so these are some examples that you'll be able to look at when this gets posted. But an example of a person who has a fever and symptoms like headache, runny nose, sore throat, things like that. And, when you should actually start to go about your normal activities. If a person has fever, but they don't have any other symptoms, again, duration to stay away from home really deals with changes once that fever ends. And when they say the fever ends without you taking medication. So without Tylenol or Motrin. Here's another example, fever and other symptoms. The fever ends, but the other symptoms take a little bit longer, all right? Person gets better and then you get a fever, okay? If you had symptoms and then you look like you're getting okay, but then you get a fever, you need to go back and stay away from others, all right? Again, until that fever ends. If you never had symptoms, but you tested positive for a respiratory virus, keep in mind that you still may be contagious. And so for at least 5 days, you need to take some added precautions, things like rotating and getting clean air, taking care of your hand hygiene, masking up, maybe some physical distancing, and then also maybe testing if you're going to be around a lot of people indoors. And it's really important to do this because you want to protect other people. So I know we've covered a lot of information in a short period of time, but what questions now do you have for me that I can help you with? So I'm going to stop my share and cut my camera on. Questions? Anyone? You can either come off of mute or you can type your question in the chat. And I do see it looks like there's some stuff in the chat. Oh, somebody said that my audio was cutting in and out. Oh, I'm sorry, Beth.
It seems to have cleared up.
Oh, okay.
I got off and came back on and it was fine.
Okay. Any questions? Okay, I'm going to actually give one that I heard yesterday because I've heard some people say this. If they got COVID recently, how long do they have to wait to actually get this year's updated shot? And what I heard yesterday, this was actually on a webinar that we had that was given by the CDC director, was it's recommended that you wait at least 2 months. Okay, maybe 3. You could stretch it out to 3, but definitely 2 months, because what you want to make sure is that the immune response that you get from the vaccine is going to be as effective as possible, provide you with the most protection as that's possible. Any other questions?
Dr. Coleman, does that also apply if you had the unupdated vaccine, say during the summer?
Yes, that does. Yes, if you had it during the summer, as long as you have had that 2 to 3 month window, then yes, you can go get it now.
What about if you've had a case of COVID? Do you also wait before you go and get a new shot?
Yes. So if you have had COVID within, I would say at least less than 2 months, you should wait until you have at least a 2-month window.
Okay.
And Dr. Coleman, you did mention the different DC villages are setting up vaccine clinics and things. And I'm sorry, I don't have a list of those right now, but if you check your village's website, you should have that information. Are there other public vaccination efforts going on this winter or this fall, Dr. Coleman?
Well, yes and no. So we do have a website that community members can make requests to be paired up or to be to reach clinical providers to do mobile clinics or come to an event. The problem that we're having right now is that we don't have a lot of providers who are willing to do that. And so we have a lot of requests, but not a lot of providers who are choosing to do that. And so, sadly, we really don't have as many as we did, obviously during the public health emergency. And a lot of this is due to the fact that, especially when it comes to COVID and RSV, the expense. And so the fact that flu vaccine is much more affordable, I'll say, for these providers to pay out because they have to buy the vaccine first, and then they can either bill you directly or bill bill your insurance provider. But when it comes to the commercial cost of the COVID vaccine and RSV for these types of mobile going to events, it's a little bit more challenging. So yeah, sad to say that.
Thanks so much for the presentation, Dr. Coleman. And again, we thank you all, the DC Villages, for having this. What's the current, what are the current options for persons who don't have insurance and who do still want to get the vaccines?
So the current option is to reach out to the federally qualified health centers. All right. And if you, I will make sure we have a list that we will make sure that not only that Dr. Polk and Carter and everyone at the Villages gets, but we'll, again, also with these slides, we'll make sure that we send that out. They have the capacity to actually meet some of the need for persons who are uninsured, but more than that, they can actually, if you go to those FQHCs, they usually have persons there who can help get uninsured persons connected to get either DC, the DC health insurance, or to see whether or not they qualify for Medicaid and help to get them registered with Medicaid. Unfortunately, we don't have a robust vaccines for adults program in this country. It is something that our current administration is committed to. But right now, the only program, a federally funded program for persons who are uninsured for vaccines is the Vaccines for Children program, which guarantees any child from birth to 18 to get all recommended vaccinations or immunizations on the schedule, but we don't have a fully funded vaccines for adults program. So that's one of those things to just kind of keep in mind as we go into the fall.
Absolutely. Thank you.
Mm-hmm. Any other questions? I'm here for you.
And we're glad that you are here for us. And we have to have you back. So let's figure out another topic.
Sure. I even though I work in the immunization division, so I'm trained actually as a health educator, and that's what I did in my previous life, as well as being a college professor. So I enjoy doing presentations like this and sharing good information that sometimes is hard to kind of wade through. The World Wide Web is wonderful, but it's so much information. Sometimes we don't know where to look. And so I try to put it all in one place. But yeah, we can definitely talk about maybe me doing something, not necessarily representing DC Health, but just as a health educator. Sure.
Oh, would love that. So I will look forward to receiving an email from you so that we can talk more. I think the seniors and not just seniors, but the caregivers as well could benefit from the information that you're sharing. And Mary has been an excellent coordinator to keep us informed and connected. So we definitely want to we find that has been some enrichment, and we will continue to collaborate with DC Health as well as you, Dr.
Wonderful.
Coleman.
Thank
But are
you.
there any other questions? So I want everybody on here to make sure that you go on our DC Village website. No, we have a YouTube channel, DC Village YouTube channel. Share this link with someone. I think we got maybe 60 people last time. We want more people to participate and receive this important information, especially during this time of year. And I would say that's about it. Any last words, Dr. Coleman?
Please, if you have any questions or concerns, when we put up this presentation, you'll see at the end of the presentation our list of email addresses. You can also call the DC Health main number. If you have any questions, ask to be transferred to the immunization division, and we'll do our best to answer questions. Keep in mind that we're not going to give medical advice, but we will answer your questions regarding immunizations. And if you still need assistance with trying to locate or identify where you need to go to get one of these immunizations. But my last words are, don't delay. Go do it now. I'm going. I have a doctor's appointment tomorrow morning, and when I go, she already knows. I said, when I come, I want to get my flu and my COVID shot at the same time. So I'm just gonna knock it out at the same time because I don't feel like coming back. So since I'm already going, I might as well get it done. So yeah, just do it. Just do it.
Sounds great. Okay, everyone. Thank you so much for your time. Look for our next presentation. When is that, Carter?
October 15th.
Mm-hmm. With my colleague Tisha Coleman. We're not related, but she's going to do a wonderful presentation on brain health.
Excellent.
I appreciate that. Thank you so much, everyone. Have a great remainder of your day.
Thank you.
Bye.